back to my video series on topics to do with pregnancy and perinatal mental health. My name is Dr. Erin Bow and I'm a clinical and perinatal psychologist, and I also teach hypnobirthing in the Macedon Ranges in Victoria. Today I want to talk to you about using visualizations. So there's a couple of different ones that we teach in hypnobirthing, but there's one I think we'll just focus on today, which is this idea of imagining filling a balloon. So I like this one because you've got the imagery of a balloon, but you've also got a bit of an anchor for helping you figure out what you're supposed to be doing with your breathing, because I think people struggle to know what to do with their breathing during relaxation anyway, but also for birth, breathing well and breathing smoothly and calmly is so important for getting enough oxygen to your brain and to baby and keeping that nice flow of oxytocin and other hormones happening. So it really starts with thinking about what is taking a deep breath. So if you're like a lot of people, when you think about taking a deep breath, your stomach actually sucks in, which isn't what we want it to do. We want it to push out. So I think using a balloon as an image can be useful, because that's your first step of thinking, okay, are you taking that breath properly? And you need to practice this obviously before you go into labour, because there's no point in trying to practice deep breathing for the first time when you're in the throes of labour. So this is thinking about beforehand, just doing some practice breaths, being watching TV or something like that, and getting your stomach to poke out. So taking your breath in, stomach should go out. And then in terms of how much oxygen and how much of a big breath, you don't want to start hyperventilating, but as a rough guide, thinking about taking a long, slow enough, smooth enough breath that you could then push that air back out into a balloon. It doesn't have to be a huge balloon, it can just be like whatever your natural breath is comfortable with. Sometimes people get stuck with things like relaxation and meditation because they think, oh, I'm supposed to count to 4, I'm supposed to count to 5. That can be useful, but it's really just whatever feels natural and comfortable. It shouldn't feel forced. It shouldn't feel, like you're about to hyperventilate or you're going to pass out, but just a natural, comfortable breath, enough to fill up a balloon. And so some people find it useful thinking about choosing a colour for blowing out that balloon. So a colour that you find peaceful, relaxing, positive, something that you just are naturally drawn to, or it might be that you choose a range of colours and you set yourself a task where you're just going to go through the colours of the rainbow or whatever colours come into your head at the time, and just imagine yourself either filling the room that you're in. So it might be, if you've seen an idea of what your hospital room will look like if you're going to a hospital, imagine filling that room with just nice kind of soft puffy balloons. That's your task. It gives you something to focus on and something to just hone in on, as well as, thinking about what your breath's doing. Or it might be you want to imagine them floating away. So seeing them drift off into the sky and just float away. Or, it might be that you're at the beach and you imagine that you're sort of just going into the ocean and you can see a bunch of coloured balloons off in the distance or something like that. It just, as I said, gives you an anchor, gives you a focus, particularly if you start getting a bit out of breath, or you feel like you are hyperventilating, or you feel like you're just getting a bit frazzled, and particularly during that transition stage where your mind just starts going everywhere anyway, having a nice visual of something to come back to can just help keep you calm, keep you focused, keep you relaxed. So as I said, in hypnobirthing and in just general life, we want to think about what can we do to relax, what can we do to keep our bodies and minds calm. These are all things I can help you with. Today is just an example of one, as I said. So if you want to know more about perinatal mental health, general mental health, hypnobirthing, anything to do with that, I'll pop my details below and you can find me there. Otherwise, I'll talk to you in my next video. Bye.